Thank you for joining us. I'm Pam Giganti. Breast cancer is the most common cancer among women in the United States after skin cancer. According to the American Cancer Society, in 2017 alone, they estimate more than 252,000 new cases of invasive breast cancer among U.S. women, and sadly, more than 40,000 breast cancer deaths. But this cancer not only affects women, more than 2,000 cases will be diagnosed in U.S. men, with roughly 460 expected to die from breast cancer this year. But thanks to early detection and advances in treatment, breast cancer is not a death sentence. In fact, new research shows U.S. death rates from breast cancer have dropped 39% between 1989 and 2015. Joining me now to talk diagnosis, treatment, and survival are breast cancer survivor Michelle Sotolongo, breast cancer survivor and chair of the Florida Breast Cancer Foundation, Dr. Amy Sanchez-Zadak, and Dr. Margaret Thompson, breast surgeon at Cleveland Clinic, Florida in Weston. Ladies, thank you so much for joining us to talk about this topic today.
Thank you.
Michelle, I want to start with you. For the record, Michelle and I have been friends for a very long time. And I remember when one of our friends called to tell me that you had breast cancer. And I called you immediately, and you picked up the phone, and the first thing you said to me was, "You heard, didn't you?" Wasn't like, "Hi, Pam." It was like, "You heard, didn't you?" And we had this really long, powerful discussion about what you'd been going through. And I remember thinking how incredibly brave you were. So tell us your story. Take us through that period of time when you were diagnosed.
I was perfectly healthy, running marathons, living life and feeling great. And I went for a routine mammogram and I was diagnosed. Immediately the radiologist came out and said, "You know, I think we need to do a biopsy on this." And that was on a Friday, and Monday I got the call that, you know, it in fact was invasive ductal carcinoma, and I needed surgery and I needed chemo, and full treatment.
What was going through your mind at that moment? Because that must have just, it seemed so overwhelming. All those terms that he just gave you too.
You know, at the beginning, it's a whole foreign language to you that you need to learn, and you need to learn it quickly. And then it's a matter of going, just making a decision and going with it, you know?
Amy, let's talk about your experience, because you're a breast cancer survivor as well. So tell us your story.
Pretty similar. I went for a 6-month, I was going every 6 months. My mother had breast cancer. I didn't have the BRCA gene, so that was unusual. But funny enough, my daughter's pediatrician said, "This is what you do. You check yourself every 6 months." So I went in May and everything was fine. I went in October and it was DCIS, which is non-invasive, and it was 8 centimeters long, and I did not have a lump. So that was a little bit of a shocker. So I went in just thinking, you know, basic checkup, and so that's what went on. The best thing is to have a support system. So I was very fortunate that I had friends in the industry that were really supportive and helpful. But yeah, similar to you, then you get educated very quickly.
I bet. So doctor, let's talk a little bit about that. You're a breast surgeon. Take us through some of what these women are going through.
Certainly. So at Cleveland Clinic, Florida, we not only see patients with breast cancer, we see patients with also non-cancerous breast lesions or any kind of breast symptoms, whether it be a breast pain, a nipple discharge, or a breast mass or abnormal breast imaging. Oftentimes when a woman has had a core needle biopsy that demonstrates a cancer, we're there to help guide them through the process. We first explain the pathology. Not all breast cancers are the same. There are different types. There are different treatment options for patients. And not every patient with breast cancer will require removal of the breast, what we call a mastectomy. Not every patient with breast cancer will require chemotherapy. And although breast cancer is a cancer, it's one of the actually more favorable type of cancers to have.
And why do you say that?
Because once it's found at an early stage, which is why we recommend annual mammograms. When breast cancer is found at an early stage and it is treated, the survival is very, very high 90 percentile.
Which is huge.
Yes.
So let's talk about when a woman should get that first mammogram. Amy, you were saying too that you had a history of it in your family, correct?
Right.
So you started your mammograms at what age?
40.
At 40, okay. Because we've heard, doctor, back and forth, it goes the age changes, or a woman doesn't need to necessarily have one every year. We've heard where maybe every 3 years. So walk us through that, because it's very confusing.
I agree. It is very confusing. And so recently, as I think it was last year, the American Cancer Society did change the recommendations for an average risk woman. We're talking about a woman who has no family history, who's not high risk for breast cancer, and who has no breast complaints. So formerly, the recommendations were that she should start at the age of 40 for an annual screening mammogram. Now, the American Cancer Society recommends that she has the choice to start at the age of 40. And definitely she should start at the age of 45 to have annual mammograms. When she reaches the age of 50 or 50, she then has the option to continue getting the mammograms once a year, or she can get it every other year.
Okay, so she really needs to talk to her doctor and almost come up with a plan for herself, right?
Absolutely, yes.
Michelle, take us a little bit deeper into your treatment and what that was like for you, because I said that you were brave, and I remember having a conversation with you after chemo. You did lose your hair, and you have beautiful hair. You've always had beautiful hair and been known for your lovely hair. So when you told me about that, I thought, wow, that must have been so hard, and you faced it head on. Take me through that.
I have to tell you that my two biggest worries upon being diagnosed was, number one, how am I going to tell my girls? How am I going to tell my girls and not fall apart? And the second one was, oh my God, I'm going to lose my hair. And I have to tell you that you worry so much more than you need to. Once you're faced with the moment, losing your hair is not so bad. It grows back. There's so much kindness in the world from your doctors, nurses, random strangers that come up to you on the day that you need it the most, and they'll just say, hey, you're gonna be okay. And the whole process wasn't quite as frightening as I thought it would be.
So in many ways, it's a mindset. And I know you're very spiritual, and you prayed about it, and you said that's helped you a lot too.
Absolutely, absolutely. I don't think I could have done it without my faith. But this is a journey that everybody has their own personal journey, and you got to do it on your terms and what you're comfortable with. So, if it's yoga, if it's praying, if it's running, if it's whatever it is that calls to you, I think that's what you need to do. I don't think any one person has the right answer of how to go through this journey.
Amy, was it that way for you too, that mindset of getting through it?
Definitely. In fact, I adopted Tinkerbell as my go-to because she was a fixer. And my daughters were 12 and 14 at that time. So, I really wanted them to see it as something that was going to be fixed. So everything, even my hospital gowns were all Tinkerbell. But what you said was exactly on the money, because our state of mind is crucial. I think that's the beginning. And sometimes we can't trust the way we think, because we really get creative.
Yeah.
Right.
And we have to get out of our heads. And that's one of the advocacy issues of let's think straight, and that's your support system. That's crucial.
Doctor, do you talk about that with your patients, that whole mindset?
Absolutely. I agree with both your guests. A positive mindset is very important. It's going to help with the recovery process. Also, eating a healthy diet is going to help. Staying active will help. Avoid things such as cigarette smoking, heavy alcohol usage will also help with the recovery. Avoidance of heavy alcohol usage will help with the recovery process.
And we hear stress too. I mean, stress plays such a heavy role, not only in breast cancer, but in so many other ailments. But try to avoid stressors, right? Or meditation, something like that would help?
Absolutely, whether it's through avoiding it either through meditation or having a good support system, whether it's just a one-to-one with somebody or a group support system. Yoga helps, Pilates help, just a walk on the beach or just walking with your pets, your family, that can be very helpful.
Yeah, I'm hearing the support system is really, really important. Amy, take us through the Florida Breast Cancer Foundation, which you are the CEO of, or in charge of, the director of. Tell us more about that.
I found home when I found. I was just talking to Michelle earlier, and we were discussing on how people approach you because now you have breast cancer and you have a story, and you can help with your story. So once I was introduced, a good friend of mine who was also diagnosed said, I really want you to meet this group, and I think it'll be great for you. And what they focus on is research, advocacy, and education. And we work in giving grants to people. One of the things that the scientific committee is really working towards now is using new researchers, and they're submitting grants. And that's really powerful because there's great minds. They're not used to handling the grants, but they really have amazing ideas. So we're really looking into that. We're looking at the educational portion of it, teaching young girls about breast health.
We were talking about that. So
Right.
they're not calling it a breast exam. What are we calling it now so that the young people can really, or younger women can really understand what they need to do?
Right. What we're focusing on right now, instead of self-exams, we're focusing on breast health. And basically understanding your body. And we know when something's off. As females, we have that intuition too, that we know something's not right. So we're trying to bring in the psychosocial, the physical, which is really important, know your body, and then putting it all together. And the key is that all the funds stay here in Florida, which is really powerful, and we really need it.
And how do you raise funds? I know there are many ways. One of them is the license plate, right?
The license plate is phenomenal, and it's an easy way too. Plus, it's such a strong significance. So we have the license plate. We have contributors. There's the National Marine Supplier. They're one of our great benefactors, and they've been providing for 5 years at the moment, and a lot of great research has come from that. So we've been working with Moffitt, and we've been providing grants and funding to them through their grants.
Michelle, what's a final word on advice you would give to women who find themselves with a diagnosis?
Hope. There is always hope. I mean, we beat it. You know, we're here, we have great, wonderful lives, and there's always hope.
Ladies, thank you so much. Thank you so much for being here. We really appreciate it. Very important topic to discuss, especially not just this month, but all the time.
Right.
And for more information on breast cancer, doctors, treatment, and research throughout Florida, visit clevelandclinic.org/Florida. And to learn more about the work of the Florida Breast Cancer Foundation, including events throughout October, visit floridabreastcancer.org. As always, we'll have these links and more for you on our Facebook page @YourSouthFL. And if you are a breast cancer survivor and want to share your story, or you have a comment on this or other topics, we would love to hear from you. Please send us your take. You can reach us on Twitter and Facebook @YourSouthFL. Send us a message or a video. We look forward to hearing from you.
Oh, I think we need to do a biopsy on this. And that was on a Friday, and Monday I got the call that, you know, it in fact was invasive ductal carcinoma, and I needed surgery and I needed chemo, and full treatment.
What was going through your mind at that moment? Because that must have it seemed so overwhelming. All those terms that he just gave you too.
You know, at the beginning, it's a whole foreign language to you that you need to learn, and you need to learn it quickly. And then
Cancer Foundation, Dr. Amy Sanchez-Zadak, and Dr. Margaret Thompson, breast surgeon at Cleveland Clinic, Florida in Weston. Ladies, thank you so much for joining us to talk about this topic today.
Thank you.
Michelle, I want to start with you. For the record, Michelle and I have been friends for a very long time. And I remember when one of our friends called to tell me that you had breast cancer. And I called you immediately, and you picked up the phone, and the first thing you said to me was, "You heard, didn't you?" Wasn't like, "Hi, Pam." It was like, "You heard, didn't you?" Thank you for joining us. I'm Pam Giganti. Breast cancer is the most common cancer among women in the United States after skin cancer. According to the American Cancer Society, in 2017 alone, they estimate more than 252,000 new cases of invasive breast cancer among U.S. women, and sadly, more than 40,000 breast cancer deaths. But this cancer not only affects women, more than 2,000 cases will be diagnosed in U.S. men. And we had this really long, powerful discussion about what you'd been going through. And I remember thinking how incredibly brave you were. So tell us your story. Take us through that period of time when you were diagnosed.
I was perfectly healthy, running marathons, living life and feeling great. And I went for a routine mammogram, and I was diagnosed. Immediately, the radiologist came out and said, you know,
with roughly 460 expected to die from breast cancer this year. But thanks to early detection and advances in treatment, breast cancer is not a death sentence. In fact, new research shows U.S. death rates from breast cancer have dropped 39% between 1989 and 2015. Joining me now to talk diagnosis, treatment, and survival are breast cancer survivor Michelle Sotolongo, breast cancer survivor and chair of the Florida Breast Cancer